Greetings everyone, my name is Dr. Ketan Barjatia. I'm a fifth year DRNB Neurosurgery resident at Bangalore. Today I'll be discussing criteria for carotid artery stenting. Carotid artery stenting is an important alternative to endarterectomy, but patient selection is absolutely critical. Let's break it down in a practical way. First, the degree of stenosis. In symptomatic patient, those with TIA or stroke in territory of the internal carotid artery, stenting is considered when the stenosis is more than 50%. In asymptomatic patient, the threshold is higher, typically more than 70% stenosis. Now second, surgical risk. Carotid stenting is preferred in patients who are high risk for carotid endarterectomy. This includes patients with significant cardiac or pulmonary comorbidities, prior neck surgery or radiation, higher carotid bifurcation making surgical access difficulty, and contralateral vocal cord palsy. Third, anatomical suitability. Favorable anatomy is essential for safe stenting. This includes accessible aortic arch, minimal vessel tortuosity, non-calcified or moderately calcified plaque, adequate distal landing zone. Heavily calcified lesions, long segment disease, or excessive tortuosity increases the procedural risk. Fourth, timing. In symptomatic patient, intervention is ideally performed within 2 weeks of the ischemic event when the benefit is highest. However, in very acute stroke, careful selection is needed to avoid hemorrhagic transformation. Fifth, age factor. Evidence suggests that the young patients, typically under 70 years, tend to have better outcome with stenting compared to older patients. And finally, embolic protection. Use of distal embolic protection device is strongly recommended to reduce the risk of procedural stroke. So to summarize, carotid artery stenting is both best suited for symptomatic significant stenosis, high risk surgical patient, favorable vascular anatomy, and timely intervention. The key is right patient, right anatomy, and an experienced center to perform this procedure.